backpack and my wallet, and I'm heading to Panera. So see y'all there. Drop my wallet. Well, good morning, sunshines, loves. I hope all of you are having a great Saturday. I'm on my way to Panera right now. I gotta go to Costco first because I am low on gas. I'm gonna go fill up my gas tank. Because it's Saturday, might as well. And then I'm scheduled to DoorDash at 5 today. But of course, I need to get some of that studying in. I have a quiz on tuberculosis on Monday. And then I have a quiz on pulmonary edema on Tuesday. I just have to go into the book and make sure I go through the whole chapter, and it is time consuming. So I'm literally gonna spend, it's 10:13 right now. So I'm gonna go put gas. I'll probably get there by 10:30. So I'll probably study from 10:30 to 5. And that's my original, you know what I mean? Like normally, sometimes I'll get to Panera at 8 in the morning, sometimes 9 in the morning, and I'll stay there till 5. Stay there all day studying. They don't tell me anything. Other people go there and study too, so I'm not the only one. And yeah, they stay there all day to study too. So if you do feel like, oh my God, what are they gonna think? Do they kick you out? Do they ever tell you anything why you're there so long? No, because I usually get breakfast and then I get lunch and then I don't get any dinner. I'll just eat dinner at home. And I don't get anything big either. Sometimes I'll just get like a drink, and then sometimes I'll get like a salad. I'll get like a drink for breakfast, and then I might get a cookie for lunch. So I don't get a lot sometimes. But yeah, I thought I'd just let you guys know that. That's my typical Saturday for you. I wake up early, I get ready and hit the Panera. It's only 5 minutes away from my house, maybe less, depending on traffic. But I am here at Costco right now, and I'm probably gonna get in one of these lines, probably this third line right here. So guys, I got 7 weeks left of term 2, which is amazing. And then we go into clinicals September the 20th or something. Well, it's like mid-September because our last day is September 17th of this semester. And I'm super excited for clinicals. I ordered me some goggles, some nursing goggles, because when we get into those TB rooms and those COVID rooms, we gotta have some goggles to cover our eyes and all that. I'm gonna go put gas and I will be right back. Gas prices actually went down. They're $5.499 at Costco. Yay. They are going down. I got 10 gallons for $55.35, which I think that's amazing because last week it was insane. I think I filled up at 72, and then prior to that it was 77. I'm not fully at 100% full, but I'll take it. Oh yeah, so if you DoorDash and you get the Dasher Direct card and you put gas at Costco, you get a percentage back. I'm not sure if it's 4% or 10%. But anyways, I got $4 back last time. So every time I put gas, I've been getting $4 back each time, which I think is amazing. amazing. Because what gas place, when you put gas, are you going to get $4 back? Nowhere. I mean, I don't know if other credit cards do that, but I don't have any credit cards. All I have is my Dasher Direct and my bank card. So, I think that's amazing. For those of you that do DoorDash, get you a Dasher Direct card and put gas at Costco. Use it at Costco. You're going to get $4 back each time. It's amazing. Here at Panera. So, I'm going to order this one. Add to the order. And it gave me a free bagel. And so I got the cinnamon swirl bagel. 310 calories. $5.63 payment. Credit card. It says applied. Dine in. Enable text. So for my pathophysiology class, we are on chapter 19, tuberculosis. And this is what I usually do. I download it into my iPad, and then I have the PowerPoint app downloaded. And basically this is all the PowerPoints, and then what I usually do is I write down the notes in my notebook, and then once I'm done writing all of the notes, I like to highlight each subject kind of thing, and then I do a quiz. So for each slide I do a tuberculosis quiz, and I have all of the questions on this page, and all of the questions on this page, and then on this one is the answers that I get directly from the slides, from the PowerPoints. And this just helps you think a little bit better and kind of grasp the information a little bit more.
But if you like escalate too fast, you have nowhere to go. It's fine.
Yellow? I got an A. I missed one. The one, turn on the turn on the AED.
I thought she was going to correct it for us.
Yeah.
Which I'm so confused because she told us something different.
Yes, she told us turn it on, and then last time
Miss A.
Told us apply the pads.
Right.
And then last time I got it wrong because I put apply the pads. And then this time I got it wrong because I put turn on the AED.
Right.
Yeah.
Turn on.
Yeah.
Oh, I'm sorry. You're recording.
Oh, it's okay. Everybody take out your incentive spirometer. With instructions. We got the mouthpiece.
Oh, it's probably because I wasn't sitting here.
I wonder if it opens up. Oh, it does. It's an accordion. Your norm? Or your base? Okay, so we're going to hook it up on this little part.
He said that's the way to expand them is to inhale it.
Inhale.
And hold
Inhale.
it to hold
And then hold your breath for what?
Until it gets to the bottom.
Oh, thank you.
So he said best tip.
Oh.
You're supposed to hold it until it gets to the bottom, fool.
Hold your breath.
Hold it, homie.
You hold your breath on here? Oh, okay. So you inhale and then you hold your breath until it
Yes,
hits.
ma'am.
Yes.
We're doing it together.
So we have to leave it here.
So
We write our name on it.
you can write your name on it that way.
Put it in your bag. I got my Sharpie right here. I don't know if I have a thick one. I must have just a thin one. Okay. What do you write your name at, huh? Breathe out. Exhale completely.
Before you do anything, you're always going to check the chart. Right?
Always check the
Some
chart.
kind of orders or lung function therapy. Okay? And what kind of patient would have to be able to use this?
Someone that can follow directions, cooperative,
Patient,
conscious.
right? Someone that can follow commands. Someone that can use their arm. You're going to have to hold it.
Put my name on there. Volumetric. Gold indicator.
For your patients to know, but you can also do
Red
what
screen
you guys
indicator.
said. You can actually get a marker and mark it. Make
Oh,
sure
the
it's
gold.
not like a dry erase marker. But there's two different little pistons or little things that measure certain things, right? This right here, and he said at the beginning, he tells the patients to ignore that, right? But what this measures that they're not breathing in too fast or too slow, right? So you want it to be like a consistent volume that's coming in. So on these, you would like this little marker to stay in between where the happy face is, right? So you would tell them to breathe in, and you want them to try to do it not too fast, because you don't want to cause any trauma with them, and not too slow, because then they be really complicated. You would want this as you have them breathe out completely. They can breathe out into the thing, or they can breathe out away from it. And then you would have them create a seal. Okay. Once they create a seal, you're gonna want them to breathe in as deeply and as consistently as possible. Again, to try to get this into a little happy face. Okay. So breathe out completely. Breathe in. So you would have them do it. And if you like,
So you're supposed to hold your breath, huh? Oh shoot, I forgot to put my
do it at least 3 times.
That was hard. Wait till it goes down. And then now you're gonna breathe in slowly.
At least 5 seconds. In 5 to 10 seconds, you'll be back. It is hard. It is hard at the beginning, like you've never done this before. You're like breathing, and then you have to cough. Do it.
You can do it? What do you mean? It didn't go up at all? Let me see. Try it again.
Hey, I can get it all the way to the top. I can
Yeah.
get it all the way to the top.
How many times do you do it before surgery?
Oh no, you don't blow in. You suck out. Yeah. Inhale. You're gonna inhale and then until you can't no more.
Hey, keep it on top.
Oh yeah.
3 times before surgery.
3 times before surgery?
what they can get before surgery.
Average.
You can have them do it 10 times before surgery, but 3 times is enough.
Made me laugh. Hold up.
So you'll find their goal, and that will be their post-op goal. Okay?
I could literally only go up to
You can write their name on the bottom, you can write their goal on the bottom, you can also mark it right there.
15,
Because I
50.
laughed. Made me laugh.
You'll want them to
I got it up
10
here.
times an hour.
How many?
10 times an hour.
10
And you don't
times
want
an
them
hour.
to do it like back to back to back to back. Because then they can end up getting dizzy.
10 times an hour.
So do a full breath, take a little break, you know, like a couple minutes or like a minute at least in between. That way they're just not. And then. Okay. So I'm very
Yeah.
So 10 times an hour. You can
How
tell them
much
to
do you
like
do?
in the commercial
Oh.
breaks, when you're watching TV, like every commercial break.
You get 1,500 or 2,000?
It's too easy.
250? 2,000
You're
or
not doing it too often. The goal
2,500.
is at least 10 times an hour. Okay? And you'll want them
That's
to do that.
hard.
If they have had surgery, okay, you will want to get have them have like a pillow. They use, especially if it's like thoracic surgery, they use the them some kind of pillows in case they have to cough. And if they do cough, you want them to hold the pillow onto wherever their incision is. That way they don't like expand their incision. And then
I literally think I'm only about between 1,500 and 2,000. That's where I'm
go
at.
ahead and
Where do you go?
educate your
2,000?
little people on how to do it. And
Very hard for us to hold the breath when it's going down. It's gonna be really hard.
It is hard to hold the breath.
yeah, so that's why when you're taking the breath, you're not trying to get to 4,000, okay? And so some of you guys are trying to get as high as possible, but that's why you have a goal set. So you just say, breathe in as deep as possible. Don't look at the numbers. Just breathe in as deep as you can and see how high you can get. Don't try to like overexpand your lungs. You don't end up having like retention pneumonia, okay? So breathe it in, and then if you do not trying to get higher than you're supposed to, it'll be easier to hold your breath.
When I'm on the happy face, it's hard to hold my breath for that long. I mean, I can't even, I get it on the happy face and then I can't hold my breath anymore. Let me see. You gotta get that happy face. It's gotta be steady. Breathe in slowly. Nope, too high. You gotta breathe in slowly.
It's hard to get to that happy face.
Because you gotta get
I
that.
get to like right here.
Breathe in slowly. Yeah.
I need to relax first. I just did it. Give me a couple seconds.
The top of the piston is where your what it would be.
But if I put it on the happy face, it does not move.
See?
I'm just saying that you're doing a consistent breath. You're
Consistent.
not like you're really.
I have to go as hard as I can. Or it won't move.
Put your eye at the eye level. Don't.
Eye level. You're breathing too hard. Breathing it in too hard.
Yeah, the field's broken. I thought it was broken. I'm very fragile.
I can get into the happy face and get to 3,000, but it's hard. It's like a struggle.
It is.
If I
It's
just breathe
hard.
my own way, I can get into it.
Yeah, if you get it, if you're taking that deep breath, it's gonna go all the way up there. But they want you to take that consistent breath so that way you can expand your lungs. See? Yeah, you didn't want too much. Too much. You're going. You're breathing. They don't want you breathing it in too fast. It hurts when you're like holding it. You're like, ooh.
All the way up.
But I had asthma since I was 12 too. Yeah, that has a lot to do with it. So at that time, I made 2,000. But you gotta be consistent. You gotta hold it consistently, and then it has to hit the happy face on there and stay on the happy face. Oh, I forgot to hold my breath on that one.
I got 500.
You gotta hold this out all the way.
Oh, that was keeping on the head.
See? You gotta keep it on that happy face. Watch. You gotta work hard. That's to expand your lungs.
It's hard to
Oh,
get
yeah.
there. I'm just gonna breathe normal because I'm.
Yeah, you did it. You did it right now. It was on there.
Normal? I feel like I was.
Were you breathing it in?
No, well,
You're
I was
holding
going-
it?
I was going
Holding your breath?
like this, but like I wasn't going hard. I wasn't
No. You don't.
doing-
You're not supposed to breathe it in hard.
Every row, I think every row has one of these.
Can we use our same mouthpiece or no? How do you plug it in? Does it have another one?
Oh, each row has one?
Yeah.
Ah, by myself.
Does it have it?
My
What is this part?
25 is my
Where does this thing go?
where it should be. So.
This one will go on the top.
Maybe it was always a little.
I broke my nail. Well, there's two of them, but one goes onto the machine. Oops. And then there's two of these. So this one goes on this side.
Is that how it goes?
Might be.
I had it in my airway. Is that any what's done?
What is this called? But it's upside down, like, because it has 1 and then 5. So how are you supposed to fix it?
And that was week 8.
There's one little thing here.
Or last.
We might be missing something.
Open it up.
What goes to what?
This is a pop. Where do you put the water? Just to put it on 5.
Connect these devices to a nebulizer.
To nebulizer.
So you can have pressure and nebulization. Okay, these ones are just the flow meter
Oh.
running through it. But you can't connect a nebulizer to it. There's more to it. That one that it shows.
On that one? Okay.
This is what it's supposed to be doing.
I put it on 6. How do you do this? Put it on 5 or Fisher? She said you could hook it up to the nebulizer. Oh, they're changing the nebulizer. No, I don't see it. And that's on 20 right there. Where do you put the Fisher at though? You put it in the top one? I think you would have to have like a little nebulizer thing. I'm How did you get it in? Or does it go in here, in this middle thing? You can try it out. I just don't know how to put the pressure. She said you could fix the pressure on this.
Oh yeah, it's
But how do you fix the pressure?
There's the pressure,
Oh.
and then the.
Oh, on there?
So you see, when I do 20,
Oh.
this comes out a lot more.
It comes out more. Oh, okay. So that's how you do it. Oh, okay.
SGC reposted our picture.
Oh yeah, they did. Yeah, she DM'd me, and then she was like, "Oh, okay, is it okay if I share your picture?" And I said, "Yeah," because I had posted it on my story, and then she asked me.
So you can't even put this in there?
She said you could hook it up to a nebulizer, but I'm not sure if you put it in there.
The first one, that's in the face, I didn't do it. Second
It's
one,
kind of weird, but 1, 2, 3,
I don't get it.
20.
How many colors? Open.
And then you can change this up. 15. You can move this to 15.
15 is what?
15, and then you can move it to 10.
Or like the flow?
Yeah, so it'll be like the flow, I guess.
Yeah, and then this is what measures. So the patient will be inhaling or exhaling, and then this is what measures their.
So let me try it. Okay,
Let me
ready?
put it on.
Put it 6. Okay.
I'll do.
Oh, sorry.
I'll do 6.
Okay, ready? It didn't move, huh? Is this spring supposed to move? Or maybe push it. Oh, you go up. It goes to 10.
I can feel the air hitting me.
Oh. Let me try 5.
Are you supposed to be breathing it in?
Breathe it in? But if I breathe it in, it doesn't move. Do you breathe in or out? Do you breathe it in or out?
I thought it was be this.
Breathe it in? But it doesn't move. See, but if I breathe, push out, it moves. That's weird. I'm trying on 15. Oh yeah, if I put it on 15, then it'll go up to 20. If I go on 20, you're like closing your lungs, so you're like pushing it out, so that's forcing all the air out of your closing your lungs. And then if you want to open your lung, because lung expansion is supposed to open your lungs. Maybe you breathe it in and then you exhale. Okay, so the air will go in and then it'll go out. Okay. Yeah, 20. So if I put it on 20, it goes to 20. If I go to 15, then it goes to 20. So if I go to 10.
No. We don't go into it. It's positive. So what it is, it's like this measures your resistance. Like put it in your mouth, but don't let any air in.
Oh, don't breathe?
Yeah, no, don't let any air in. Breathe like a Put it in your mouth.
Just like
Just hold it. Yeah,
just
still
hold
it.
it.
You guys good on the IF?
Yeah, see how it went up a little bit?
Oh.
That it measures the resistance. So obviously we're not gonna have any because we're clear.
So we're not gonna breathe it in.
No. And then what this thing does, like if you're blowing into it, 20 makes it harder to push it to 5. So you probably adjust it. Yeah, you probably adjust it depending on their resistance.
So you measure the resistance.
Yeah, that's what it is. Like if you hold it,
Yeah, that went high. It went up to 5? No, not even like maybe 1. Or it went to 0 because that little line.
You don't have a flow meter.
Okay, sorry, I don't have a phone. Hold on, there you go. Who turned on the cell?
Okay, 10. So you basically just create a seal and you don't breathe in and you don't breathe out.
We're supposed to always create a seal.
But this time you don't breathe in and you don't breathe out. You just go like this.
This measures your resistance.
Okay, that's good for.
You let your mouth fill with the air, and then it'll start moving up, and it just measures your resistance. The nebulizer? How do you do the nebulizer?
If you were going to use a nebulizer, you would take off the mouthpiece and you would attach the nebulizer here and then have the mouthpiece over there. You can use the nebulizer's mouthpiece like this.
Oh, okay.
Just attach it and then
Oh,
you would still have to, you'd have to have 2 flow meters.
oh, two.
You would have to have 2. Because if you don't have 2 flow meters, you won't be able to actually nebulize and have 2 flows. You know, this has to have a flow. The nebulizer has to have a flow.
Oh. And what is the flow for this one supposed to be at?
This is 8.
Oh,
Same
8.
as a nebulizer.
So this one's always 8. Okay. And then
And you can adjust it. So like say like this is supposed to measure what you're at, right?
Yeah.
So you're setting it to 20.
Yeah.
So when you obstruct it or when the patient's breathing, it should go to 20. If
20?
it's not, then you can adjust the flow to get to
Oh,
where
okay.
you're
Let's
supposed
see. So I kind of went like adjusted. Yeah.
So what is it for?
So it's for measure your resistance, and you don't inhale it. You just create a seal, and then this little thing's gonna go up. So if it's at 20, this has to hit 20, and if it's not, then you gotta lower down the FiO2. But normally it's supposed to be at 8, always at flow at 8. But if it's not measuring the 20, then you gotta lower it down.
But how would you know after surgery though? Like what to set it at?
If they have surgery.
Yeah, after surgery.
So you always set it at 8, and then if they're not, and then you let them use it, and then if it's not measuring to 20, then you gotta lower it down. Because the normal is 20. It's always got to hit that 20. And then she said if you want to put a nebulizer, then you just take off this, and then you put the nebulizer on this side, and then the nebulizer has to be hooked up to the flow meter too. So you'll have 2 flow meters set at 8.
You gotta tell me?
So this is just the resistance, measures your resistance. It's a positive air pressure, but I don't know what, is it called a PAP? Oh, okay. Hey guys, so I just got out of class right now and we did our labs, our incentive spirometry labs, and we also did easy PAP. And I will show you guys what we kind of did. Right now I'm on my lunch break, and then my next class is at 1, my chemistry. But I'm not hungry, so I'm just gonna go ahead and head to the library, and I have a quiz tomorrow for my clinical laboratory class, and the quiz is going to be on lung expansion. So that's what we lectured on today. So this class, we get to use our notes on our quiz, which is amazing. So I gotta go write some really good notes right now. And then I gotta print out my chemistry homework for my new homework week and get ready for my chemistry class. So come along with me. Well, the lighting right here is so much better than the lighting over here. See? Yeah. just going to check my classes now and see what I have due. So I have my weekly journal that's due this week, so I will go ahead and get started on that. I'm gonna record my patient assessments today. You ready?
I'm gonna sit here.
Okay, Tyler.
Yeah.
It is 8.
Which one are you doing?
8:19. I'm gonna do patient 32 years old. 8:19.
August already.
Okay, so today's the what? 4th?
Which one are you doing that on the first one?
I'm gonna do
32-year-old.
scenario 32-year-old patient, 120 kilograms with history of COPD. And what's okay? Your age is right here. So do I just copy the same age? Okay, I'm gonna check the chart. I'm gonna wash my hands, and I am going to introduce myself. Hello, my name is Andrea. I'm gonna be your RT today. Can I check your bracelet and your date of birth? Okay. Bracelet, date of, what's your name? And then your date of birth?
96.
Alrighty. And how are you feeling today?
Just tired.
Okay, so your skin color looks normal. Your mentation is oriented times 4.
Yeah. Are we doing
What?
the actual patient scenario, or are we doing like them in real life?
So she wants us to do these like the normal, and then this is their real heart rate, respiratory rate, and then their real breath sounds normal. Subjective is what they say, huh?
Yeah. So he's just tired.
I'm just tired right here.
What'd you call me? But
And then, I keep messing up. Okay, that's supposed to go there. Okay, and then the lung expansion, that's what's gonna match this. The lung expansion's gonna match that.
your work of breathing is normal.
Just tired. Okay. So is it okay if I get your vital signs for today?
Yeah.
Okay. So have your finger. Put that on there. Okay, so your SpO2 is 97 and your heart rate is 42. That's low. He has a very low heart rate.
He does. Nice.
Alright, I'll take that. Is it okay if I listen to your lungs today?
Yeah. No
Okay.
problem. No problem.
Okay, can you turn this way so I can get
Wait, you're inhaling.
So we're just gonna.
Take a deep breath in.
Out and then inhale.
What is this?
That's yours.
Okay, that's fine.
Damn, I was breathing deep for a minute. I need to relax.
So you want to make sure this thing is stretched out.
I need to shake.
I need to always set my
Breath out.
timer. So for the respiratory rates, you watch it rise for 15 seconds,
And how do we do our goal?
and then you count that to
Goal.
times 4.
You can find a generalized goal in here.
15 times 4? Okay, so 15, not 15, I mean not 15 times 4, but
So, for example, his breath, his RR was 4.
in 15
Yeah,
seconds.
50 seconds, you do 4 times 4.
4 times 4. Okay, ready? I'm gonna listen. I'm gonna look at sit up straight. I'm just gonna look at your breath sounds. I mean, not your breath sounds. Your respiratory rate. And then the goal is to
Or is it just about using these things? This is
for the goal. Do you say like decrease consolidation?
Hey, quick question. So you see how this next one, your quadriplegic patient with an ineffective cough, will we use the cough assist,
Cough
right?
assist, because they're quadriplegic.
We're not using anything jelly with.
Since
It all
they-
ties in together.
Since they're completely what is
Paralyzed,
it?
like
Paralyzed.
you guys.
They're completely paralyzed. They're not able to use their hands.
We're using, we did last week too.
Yeah, we're gonna use the lung expansion therapy that we did last week, and then whatever hyperinflation for this week. So cough assist would be lung expansion, and then what kind of? That's it, huh? I mean, you could do cough and deep. Oh wait, no, they can't do cough and deep breath. They could do. Oh, you could do the chest vest on them to loosen up the.
But they're not.
Oh, they can't sit up. They can't sit up.
No, the vest is used on quadriplegic.
Is it?
Yeah.
Oh, I thought they had to sit up.
No.
To use it.
No. Mrs. A, the vest can be used on a quadriplegic, right? No. I was just saying.
It's a lung expansion.
No, that's to shake the secretion.
Oh,
Yeah. But we'll use
that's airway
we'll
clearance.
use the cough assist, right?
So we're gonna use. So if it says lung expansion, we're only gonna write lung expansion. We're not gonna do airway clearance in there. Oh.
No, it wants a goal too.
What kind of goal do we set?
I just put cough assist to be used for patients that produce inadequate coughs.
Produce adequate cough.
Adequate coughs. They have an ineffective cough.
Oh.
Oh wait, ineffective. Wouldn't that mean like they can't?
They're not
hack up
able
all
to
that?
cough. They're not able to cough.
To hack up all that.
So you wanna. Their goal is to get rid of the mucus, I guess. Airway
Well, I
clearance,
mean,
and
with adequate cough, you know you'll get that. So.
they have an ineffective cough. So I don't know.